Hey, I'm Dr. Anver with the Texas Center for Oral Surgery and Dental Implants, and here's what you can expect after having your wisdom teeth removed. A little bit of pain and swelling are completely normal. Most patients experience 2 to 3 days of discomfort after the procedure, and the swelling sometimes can last longer than that. We recommend that you start taking the medications as prescribed on a schedule that you and I will discuss at our consultation to help minimize the discomfort that you experience. It's completely normal to experience some oozing from the surgical sites after the extraction. The best thing that you can do is fold up a piece of gauze, put it in the back of your mouth, and bite down firmly for about 30 minutes. Once you take that gauze out, as long as your mouth isn't filling up with blood, you should be fine. As was discussed, you can help minimize your discomfort from the swelling by keeping your head elevated for the first several days after surgery. The use of ice packs can also help minimize the swelling, and you should use them for the first few days as well. You can begin brushing your teeth and rinsing your mouth the next day following surgery. If you're prescribed a medicated mouth rinse, use it as it was prescribed. If not, a cup of water with a teaspoon of salt works just as great. We recommend for your comfort to eat a soft diet for the first 2 to 3 days after surgery, usually nothing harder than a mashed potato. After that, you can increase what you eat based on how you are tolerating it, but just make sure you keep your mouth clean after you eat. Whether using the medicated mouth rinse or warm salt water, it's important to remember that you are not in a Listerine commercial. We don't need you to swish very vigorously. Just a little bit of liquid swishing around in your head and leaning over a sink to let it come out will do the job. You may have been given an irrigating syringe as part of your post-op kit. On the 4th day after surgery, we recommend that you use that syringe by putting it directly into the sockets where the wisdom teeth were removed and gently flushing out those sites. If you did it right, you can expect a little bit of food, debris, and maybe even a little bit of blood. That's totally normal. It is recommended that you use the syringe at least 2 to 3 times a day, especially after eating. With many of our younger patients, they are able to resume their normal activities well within a week. For some of our adult patients, the recovery process can take a little bit longer. Regardless, we recommend that you avoid strenuous activity or vigorous exercising for at least 72 hours after your procedure. As a reminder, it is unsafe to drive or operate heavy machinery the day of your surgery if you had anesthesia, as well as while you are taking strong pain medication postoperatively. As was discussed, please take your medications as prescribed. If you feel like you're not tolerating a certain medication, don't hesitate to reach out to our office and let one of our team members know. If you have any other questions, don't hesitate to call me on my cell or shoot me a text message and let me know what I can do to help.